Good morning, everyone.
Morning.
Good morning.
Thank you. I can't see people yet, so
Good
I'm
morning.
gonna figure this out. Welcome to the North Carolina Caregiving Policy Summit. As we were talking earlier, if you are not supposed to be on this plane, if you weren't planning to go to the North Carolina Caregiving Policy Summit, you may want to step off the plane now. I need to get my video panel up. Okay, can everyone see my slides okay? Excellent.
Look great, Karen. Thanks. And we
All right.
are letting people in, so I think the waiting room is now empty. A couple more people, but I think we're in good shape to get started.
Okay. All right. So we are excited to start day one of the North Carolina Caregiving Policy Summit, Changing the Care Conversation. I'm Karen Appert. I am currently working with the Division of Aging and Adult Services on the Senior Farmers Market Nutrition Program and some other Senior Hunger Initiative projects. I was the longtime caregiver of a mother with MS and dementia, and it's difficult to say was now, but she passed away in March. Her piecing together her care is a big part of the inspiration for why I switched careers to the aging field and why I still am so involved in caregiving advocacy and work around ways to better support caregivers. I am also co-lead of the Caregiver and Patient Engagement Work Group of the North Carolina Serious Illness Coalition, along with Heather Burkhart. And if Heather could introduce herself now, she is co-leading with me on this summit.
Thanks, Karen. Good morning, everybody. I'm Heather Burkhart. I have the pleasure of being the Executive Director of the North Carolina Coalition on Aging. And the Coalition on Aging is a nonprofit organization that gives voice to older adult issues through collective advocacy, public policy, and education. So we have always, for our long-standing 30-year history, supported family caregivers as part of a very important piece of the long-term care continuum, and are honored to be part of the North Carolina Serious Illness Coalition and be involved in the work that they've done with the caregiver and patient engagement work. So we're really excited to be part of this project and to share with you some of the work that we've done, but really starting these conversations in North Carolina with the expertise and centering the voices of family caregiving. Thank you, Karen.
Thanks, Heather. So just a quick overview of why we're here. This project is the culmination of a grant project we started a little over a year ago called the Changing the Care Conversation project. It was a year-long grant that North Carolina was one of 10 states selected to work on this project. And you see the goals of the project on the slide, and it was to build grassroots efforts of a diverse group of family caregivers at the state level. This was all around the time that the Raise Family Caregiver Act was coming out, and the report to Congress was getting put together. So we felt really strongly that we wanted to participate in this. You'll learn more about the three coalitions that you'll see up there: the Serious Illness Coalition, the Coalition on Aging, and the Children's Complex Care Coalition of North Carolina. We all put our heads together, and we really decided that this was an important project to look at caregiving across the lifespan. That will be a theme you'll hear throughout this summit, and part of the reason we are so excited to work on this today and going forward. So in our project, we selected 10 caregiver champions who you will meet soon, some in person, some via video. Well, I guess we're all virtual right now, but we have a lot of them here today with us. These caregiver champions attended workshops with us, and we were able to get together and talk about the issues that were faced across the lifespan. And as I mentioned, the summit is the culmination of that project. So the summit, the way we're looking at it today, we're going to honor the name Changing the Care Conversation and really ask for this to be a conversation. You see the caregiver champions here, and we want their voices to be the lead to each topic. So we will center each topic that we are going to be talking about over the next few days in their stories. We wanted this summit to be a little different than most conferences you may have been to. A lot of times we heard over and over again from the caregiver champions that, you know, you sometimes get tired of being talked to. And so we're asking for this to be conversational, not presentations. You'll see that a lot of the discussions are being handled, but they will all be led by the caregiver voices. So with that, I'm going to go ahead and play a quick video. This is our Changing the Care Conversation webpage. And this video is a montage video of the caregiver champions that were recorded again as part of one of our exercises that we went through in training in raising your voice to advocate for better supports for caregivers across the state. So let me play this.
The overwhelming experience trying to navigate another person's life, and you have no idea what you're doing. That is overwhelming.
Raising a child shouldn't be something you have to survive. It shouldn't be something that they have to survive.
Oftentimes people think that caregiving consists of meeting practical needs, right? Food, those type of things. And while that is important, there's also the other aspect, emotional, social, those type of needs.
One of the things that a good friend of mine who is a geriatric care manager said to me at the beginning of this journey was that what I should prepare for is not what I think will happen, but what could happen.
If you're a caregiver, you're an advocate because you're advocating for the person that you're helping.
It's definitely very personal for me. I think for most people that are in this walk of life, it has to be personal.
I took early retirement from the state of North Carolina to move back to my hometown so that I could help my aging parents.
I actually had to step down from work and dedicate my entire life to advocate for her and for my son. So what that meant for our family is that we have to change our entire dynamics.
As I think about what other caregivers are going through, it's just really important that people don't feel alone. And so in my work now, that's the number one thing I tell them is you're not alone.
You know that things are, especially if it's a progressive illness, things are going to get worse. If you can start getting your resources in line for those things that might be happening, even if they never do, then you can try to be a little bit more prepared for those next steps and not have it be a crisis situation.
These individuals are amazing that we're caring for. They deserve the absolute best. They deserve people that understand them. They deserve for their caregivers to have the opportunity to get the education that they need to help them understand and navigate the world in the way that they see and experience it.
Okay. So that gets me every time. These caregivers have been inspirational to all of us who have worked with them. I think you'll learn more about how, again, that caregiving across the lifespan, the way we approach it really informed some of the things we're going to be talking about here. A couple things I wanted to mention before we move on. These are caregivers who are helping loved ones. They're doing the daily, sometimes 24/7 work. These are people who are really putting amazing amounts of time into the caregiving that they're doing. That's affecting their day-to-day life. Often it affects their employment and financial issues, which are a couple of the things we're going to be talking about. In the course of this year, we actually had 4 caregivers who had family members pass away, and all decided to continue on this project, which tells you about the dedication and the efforts. It chokes me up because everybody continued on this journey with us. And I think that speaks to the amazing resilience of many caregivers. I also want to mention that we're not covering, we're not detailing many of the topics that you all know about that really impact caregivers, including the direct care workforce, health issues faced by caregivers, mental and physical health, caregivers included as partners of the healthcare team, or as just being more considered in healthcare. And I wanted to mention that the summit is not, we're not coming up with answers at the end of the summit. What we're asking for all of you to consider is why we should be looking at caregiving as a lifespan issue in North Carolina. And we often talk to the same groups over and over, and we always talk about the silos that we get in, and we're asking you to consider reaching out and looking at some of the groups that are on this summit, and part of this not just part of the panelists, but the audience members, and looking at reaching out and starting new conversations with those people as well. With that in mind, we are not going to have a lot of time for Q&A today, so we're going to ask you to put any questions or comments that you have in the chat, and we will be happy to address those if there's time at the end, or we may have a little more time tomorrow to be able to address things that we weren't able to address today. And we will also be following up on anything that comes up in the chat. Did I miss anything, Heather?
No, you did great. So thank you. Karen, I will say there was one comment that maybe your slides were blurry. They're looking fine on my screen, but if anybody else is experiencing the blurry slides, please let us know. So, and welcome to those who have joined. We've admitted several, so thank you for being here today. I will go ahead and just give you a quick, before we jump in, an overview of what to expect today and also tomorrow as we go through this time together. First, we will be welcoming Greg Link from the U.S. Administration of Community Living. He'll provide a great national overview of some of the exciting things going on. And then we will dive into our conversations. And so we are just honored that you can be part of these conversations and dialogues and lend your expertise through comments as well. So our first is really bridging the themes that you saw so beautifully in the video montage about why we're stronger together when we think about caregiving across the lifespan, and some of the work that's gone on in North Carolina to build this bridge across the generations, all on the foundation of caregiving and that shared experiencing. And then we'll move into our second conversation, which is on the barriers of supports and services. And so those formal services are so important to families, but we also know that equally there are broad gaps in those services. And so we want to lift those up in conversation. We will wrap up promptly at 1:30. And then tomorrow we will come back on the same link at the same time for additional conversations. And so tomorrow we're going to talk about the multifaceted challenges and policy solutions around employment issues for caregivers and those financial issues and how they even intertwine in so many different ways. So good deep conversations tomorrow as well. So without further ado, and it is my pleasure to join, to kick off the summit. We have the honor of having Greg Link with us today. And Greg is the director of the Office of Support supportive and caregiver services with the U.S. Administration for Community Living, the Administration on Aging. And in that role, he oversees programs funded by the Older Americans Act, which include the in-home supportive services, the National Family Caregiver Support Program, as well as the Alzheimer's disease programs. And in addition to this wealth and long history focused on caregiving, Greg has also been a family caregiver, a long distance family caregiver to his parents. He is here today to provide us with the national context of caregiving across the lifespan, and will share with us some timely and relevant information about federal initiatives which are spurring excitement nationally, but also here in North Carolina around caregiver policy. Greg, we are honored to have you today, and so you participants know he is taking time away from the White House to be with us. He's joining us from Washington, D.C. So thank you, Greg, for being here.
Thank you so much, Heather and Karen, for inviting me to be part of this. Do you want me to share my slides, or are you going to? I can do either.
Yeah. Actually, if you can share, I just got a note that my internet is unstable. So let's see if it works on your end.
Okay, I'm going to need somebody to enable me to screen share, or share screens.
Oh, that's right. And I apologize about that. Mine started acting really wonky all of a sudden.
Well, while we're figuring out the technology, I just want to thank you all so much for allowing me to join you for the first few minutes of this incredibly rich sounding summit that you all are holding. I have to say, watching that video brought back so many memories, not only to me personally in the care journey I took with my parents before they passed in 2020, but also in the work that my team and I did to pull together the national strategy to support family caregivers. A big component of that work was to include and honor the voices of family caregivers throughout our work, whether it was through the initial strategy or the initial report to Congress, or whether it was to really begin to build and develop the national strategy to support family caregivers. So I'm able to.
You should be able to, Greg.
Yes, I've got it, and I'm going to try to do the slideshow. So what I want to talk to you all about today is our work to develop and deliver to Congress and the nation, really, the first national strategy to support family caregivers. And the little bit that I know about the work that you all are doing as a group and the summit that you're holding speaks, there are so many parallels to the work that we did at the national level. And so it is very heartening for me to see that. What I also found incredibly moving were those videos, because those video testimonials, because in our work to develop and inform the national strategy, we also heard things like, when you're starting the journey, you don't have enough knowledge to know what you need. And I know that certainly was true for me. And I feel like I'm sort of up on these issues. And yet when I was confronted full on with having to develop a system to support my own parents, I didn't know what I was doing. I didn't know what I needed. And I think a lot of that has to do because it's so personal, it's so emotional, that any knowledge that we have just kind of flies right out the window. But we also know that it's, that there's safety in numbers and there's help in numbers. And we also heard that it would have been immensely helpful to hear about other people and to know that you're not alone in this caregiving journey, because it can be a truly isolating experience. And a big one was that nobody ever taught me how to do the medical portion of caring for my son. It can be scary. I wish someone like a nurse could have spent more time teaching me how to use his medical equipment. And yes, family caregivers do everything. Family caregiving can start with just regular phone calls to a loved one to check on their well-being, all the way to what this person talked about is complex, intense medical care that requires great skill. And there's everything in between. And we need to be able to address all of those needs, from the simplest to the most complex. So I know that I'm preaching to the choir, and so I'm only going to spend 2 seconds talking about this, but we know that the number that we do know is that there's approximately 53 million adults that provide family member provide care to a family member or friend. And 24% care for more than one person. And 26% find that they have difficulty coordinating care. We also know that there's 2.5 million or so grandparents raising grandkids, and that population of family caregivers isn't necessarily the oldest of the old. They can range from age 30 to 59, and there's incredible. This is incredibly more prevalent in our ethnic and culturally diverse populations. And I throw these numbers out, but I think that those are just estimates. Family caregivers are often very slow or unable to identify as such. And so even when asked, may not say that they're a family caregiver. So I would argue that 53 million family caregivers in the US is probably an undercount. So you all are part of work that has been gradually building momentum, I would say, for the past 20, 25, 30 years. And we've seen a steady march over the past 20 years to a greater legislative recognition of the importance of supporting and recognizing family caregivers, really beginning with the creation of the National Family Caregiver Support Program and the Native American Caregiver Support Program in the 2000 reauthorization of the Older Americans Act. That really marked the first federal recognition of the importance that family caregivers play in the health and long-term services and support system, and also the fact that what they are doing is so absolutely critically important. 10 years later, we saw the establishment of the VA Caregiver Support Program. We saw the Lifespan Respite Care Program come on the scene in 2006, and implementation began in 2009. The Raise Family Caregivers Act, which is what I'm going to talk most about today, appeared on the scene in 2017, followed closely by the Supporting Grandparents Raising Grandchildren Act. And together, those two pieces of legislation and the activities that they created and authorized at the national level are what led to the development of the National Strategy to Support Family Caregivers. We've also seen on the child welfare side, the 2018 Families First Prevention Act. And then in 2021, with the passage of the American Rescue Plan, Congress specifically directed ACL to establish a National Technical Assistance Center on kinship and grand families. And this is just a sampling of some of the key pieces of legislation that my team and I, that ACL most closely interacts with on a regular basis. There have been many other legislative actions, policy changes, executive orders, as we just saw a couple of weeks ago, President Biden issuing his CARE EO, which is really groundbreaking when you think about the issues of family caregiving and the direct care workforce. Have the attention of this administration. They have attention at the White House. I think this is an absolutely key time for you all to be doing the work that you're doing. So the RAISE Act, as I said, was passed into law in 2018. It has three key components: the establishment of a Family Caregiving Advisory Council. That council is comprised of both employees or members of federal departments and agencies across the federal government, as well as up to 15 non-federal members. That's people like all of you. And I can tell you that every single one of those 15 non-federal members of the Advisory Council had some experience or some connection to family caregiving, whether they were family caregivers themselves or they were receiving supports from family members. The second key component was the development and publication and delivery to Congress of this initial report to Congress, which laid the groundwork for the national strategy, which came out in September of last year. And that is the third component of the RAISE Act. Let's see here. Okay. I want to just pause for a moment because and talk about the importance of the fact that this work didn't happen in a vacuum. And when the RAISE Act was passed, it initially didn't come with any resources for ACL to implement, meaning Congress didn't appropriate funds for us to do this work. That came a little bit later, but in the interim, the John A. Hartford Foundation is a national philanthropy that has a long history of supporting some of ACL's most important projects, approached me and said, how could they be supportive in assisting with us, our implementation of the RAISE Act. And so They funded the National Academy for State Health Policy to stand up the RAISE Family Caregiver Resource and Dissemination Center, which really provides technical assistance to both the Caregiving Advisory Council, but also has a lot of outward-facing technical assistance to states and communities to give them the tools and resources they need to actually operationalize and implement what is in the national strategy, providing roadmaps for states on all of the priority areas that the strategy talks about. This public-private partnership also enabled us as ACL, the federal government, to do extensive public outreach that without it, we couldn't have done. We would not have been able to engage as easily as we did with members of the public, because there's a lot of limits to what we as federal agencies can do to interview and survey folks. But on the private side, anything, pretty much anything can happen. And so we were able to work in this beautiful partnership to really ensure that the voices of family caregivers and hundreds of key stakeholders across this policy area were engaged in the conversation and in how the strategy took shape. So here's just a little bit of some of the public engagement that was done. It started with ACL issuing a request for information back in 2019. We can do that very easily. We can ask for opinions and input. We got over 1,600 responses, and that led to NASHP and their partners developing caregiver focus groups that really delved into some of the findings in the RFI. We looked at all populations of family caregivers, including youth caregivers, caregiving youth who oftentimes put their schooling on hold, or their social lives and social development are greatly impacted by caregiving roles that they take on. There were also a number of stakeholder listening sessions in this first round. And then as we moved over to the development of the national strategy, additional stakeholder interviews and listening sessions were held by this group to really delve into how do we operationalize the recommendations that are in the that were in the initial report to Congress and turn that into a strategy, which is exactly what happened. So I can't say enough about the importance of public-private partnerships. It works great at the federal level. I hope and I get a sense that there's a really strong public-private partnership and goals and objectives there in North Carolina, and that's really great. The strategy is grounded in 5 priority areas for actions. These are not surprising. It's around awareness and outreach to family caregivers, engagement and ensuring that family caregivers are partners when and where appropriate in healthcare and long-term services and support systems, actual services and supports for family caregivers, addressing some of the financial and workplace security issues that family caregivers face as a result of their roles, and then ensuring that we have robust research data and evidence-informed practices so that we can understand the needs of family caregivers, their experiences, but then also have the most effective interventions to help support them. The strategy, and I've sent these slides to Heather and Karen. You all are welcome to use them and have them. The strategy consists of 4 main components. It's not a tiny document. It is not a short read. But we believe that these 4 components, when taken together, can provide a nice roadmap for a whole of society approach to how we better understand, recognize, and support the needs of family caregivers. The first document is basically an overview of this and description of the strategy's goals and intended outcomes. We address several key cross-cutting considerations that must be considered and understood as we work in any of these priority areas and on any of the recommendations, and I'll talk about those in just a second. And then we were really amazed of the collaboration with 15 of our federal sister agencies across the government, not just within HHS, but we had Department of Labor, we had Social Security, the Consumer Financial Protection Bureau, Department of Education, all coming together and contributing 350 actions that they can take as federal agencies to really move the ball in how we recognize and support family caregivers. And then we have more than 150 actions that states, communities, and others can take to begin to operationalize what's in the strategy under each of those recommendations. And that's really where our stakeholder engagement helped us flesh out the possibilities. And what you'll find is a very, very broad framework that any sector that is interested or has a stake in supporting family caregivers can really tap into this as a resource and figure out for themselves what is the greatest need in their particular area that they are looking to better support family caregivers. The cross-cutting themes that the council felt were so critical was ensuring that every action that's undertaken to better support family caregivers includes placing the person and the family at the center of all interactions, meaning any policy development, any policy changes, any program development, any new initiative that's developed on behalf of or in support of family caregivers should include family members and family caregivers as part of that planning and rollout. The second is addressing trauma and its impact on families. We know that trauma is pervasive, it's under-recognized, and it can also have a tremendous impact on how a family system, how an individual or a group of individuals within a family can understand and really accept services and supports to meet their needs. We also understand that family caregiving is a very diverse experience. It's different for every single individual that is in a caregiving situation. And then when you add the complexities of race and ethnicity and cultural mores you overlay that on the family caregiving experience, we have to ensure that there is equity in everything that we do to ensure that everyone has equal opportunity to access and benefit from the improvements that we're looking to make. And then I don't think I need to tell anybody, we are in a severe direct care workforce crisis. And family caregivers are only one part of the caregiving equation. It is the direct care workers that hand in hand must work together with family caregivers. And if one group of individuals goes down or is unable to meet the needs through, let's say, the direct care workforce, family caregivers will be left to carry the load, and vice versa. And so it is not an either or discussion, it is a both and discussion. And so we have to think of the direct care workforce in all that we do. So the strategy really takes a whole of society approach in how it is conceived and how it was developed. There is something in this for everybody. So I would argue that for your coalition there in North Carolina, for purposes of this summit, you are woven throughout this, and it's up to you to find what's in the strategy for you. What are North Carolina's particular needs? What opportunities does North Carolina have to really begin to tap into the strengths that exist and amplify those, and look at where improvements and development can be undertaken to really enhance what's in it for family care, what's available to family caregivers. So the strategy, this is probably just a sampling of the potential sectors that can benefit from and tap into what is in the strategy. But there's something in here for everybody. It isn't just the federal government. It isn't just states. It's not just communities. It's everybody. And so we really hope that sectors far and wide will take a look at the strategy as a tool for them. So I think that there is a lot of opportunity within the strategy, and I'm so heartened to see a summit like this coming together where you are beginning to have these really deep conversations about how you can move the policy and practice ball in terms of better supporting family caregivers. And I think that some of the biggest opportunities that are out there for states and communities are ways to ensure that there are open and better communication pathways between family caregivers, care receivers, healthcare providers, and healthcare systems. We hear this time and time again. Family caregivers are on the outside of a discussion about how to, about discharge planning, about what services and supports will be put in place for someone who needs support. And it's oftentimes just assumed, well, the family members there. Families have to be part of that conversation. Family caregivers have to be part of the conversation at the very beginning, and we have to have dedicated staff in these various places, hospitals, healthcare clinics, hospitals, nursing facilities, other long-term care facilities, really any place where an individual seeks care. We need to have staff who understand the importance of including the family caregiver in what they're doing. And we have to assess the needs of the family caregiver along those of the care receiver. And family caregivers may have a very different set of expectations or needs. And those have to be understood and planned for and supported as well. And then there's a lot we can do around partnering with local community-based agencies to ensure that there's a smooth referral system, that caregivers don't fall through the cracks. Family caregivers should have an opportunity to have a voice in planning, as I mentioned before. Ensure that policy setting processes include documenting and responding to the needs of family, kin, and grandparent caregivers. Caregiver assessments, there's a real opportunity. Momentum is gaining around family caregiver assessments and really taking an evidence-based approach to how we understand what family caregivers need, because what respite may work for one family caregiver, but it may be something completely different that another family caregiver needs, maybe education and training so that they feel comfortable in what they're doing in their caregiving role before respite can even be part of the conversation. So it's different for everybody. And then we have to make sure that how we outreach, every piece of information that we present, intake forms, all adopt inclusive, respectful language that can help family caregivers identify. So I really think that we have the time is right now, and I'm so heartened, as I said again, family caregiving can be this huge mix of anxiety and empowerment and being overwhelming on 1 minute, exhausting, but then gratifying. And it can be a very lonely journey, but it can also be one that's very hopeful. And if we understand the complexity of family caregiving, I think that the strategy that we now have can help elevate and elevate the conversation and reframe the narrative. And I think it can serve as a driver for change and innovation. It's a tool for advocates. Absolutely, there's so much in here for advocates, but we also see this as an opportunity. The strategy is an opportunity to guide program development and shape research and data gathering as we move forward. So with that, I just want to leave you with the words of one of the members of the Family Caregiving Advisory Council, Carol Zernial. She said at one of our meetings, how do we create a world where caregiving is central to who we are, as opposed to something that diverts us or is on the sideline of our real lives? I think it needs to become part of that conversation. It needs to be as ingrained as becoming a parent for the first time, or as getting married, or what have you. It has to be part of that conversation. It can't be shoved to the side and ignored until all of a sudden we're in this situation. So there are some tools and resources that, as I had mentioned, the NASHP's RAISE Resource and Dissemination Center is there to support you, to help you, to provide you information and the tools you need. ACL also has some information that you all are welcome to tap as you do social media and messaging and need handouts for presentations and other things to draw upon. So with that, I say thank you for having me here. I wish you all the best in this summit. Karen or Heather, I turn it back over to you.
Thank you, Greg. We really appreciate you being here.
My pleasure.
And you're welcome to stay. I know you've got a lot going on there. And again, I think you've framed what we intend to have happen at this summit in the perfect way, which is across all sectors, across all aspects of life, and across all illness or disability, across anything that that any caregivers might have that they're dealing with. This is what we want to be talking about today and tomorrow. So thank you again.
Thank you. I am going to drop off because they're going to kick me out of this room here in about 15 minutes. So
that's fine. We really appreciate it.
Again, thank you all so much. Good luck. And if I can be of any help or resource later on, please just feel free to reach out to me. I am here.
Thank you again.
Okay. Take care, y'all.
Bye. I'm going to share my screen again. And we're going to move on to our first topic. Can everyone see? I can't see all of you, so hang on. I don't know why why my video panel doesn't come up automatically. So
Karen, it looks great. We can see it.
Okay, thank you. Again, I think he framed what we're looking to do at this summit. we want to move on and kind of quickly go to our first topic, which is caregiving across the lifespan. We're not going to go into a lot of details. You all know a lot of these data points. What we did want to mention is that these are from an article called Caregiving Across the Life Course, a health policy priority for North Carolina, that ran in March 2023 of in the North Carolina Medical Journal. I think Heather Altman had posted a link to this article in the chat, so you're welcome to take a look at it. I'm going to let you look at these 2 bullet points because I think, again, it frames the summit and part of the reason why we're here and the reason why we're talking about it across the lifespan. The authors are on our panel right now, and we will be speaking to them in a minute. But it's basically that the groups that we mentioned earlier, the North Carolina Serious Illness Coalition, the Coalition on Aging, and the Children's Complex Care Coalition of North Carolina, got together in November 2021, really came together as a loosely affiliated group saying that we wanted to look at caregiving, raising caregiving to the primary focus of, a lot of times caregivers are seen as secondary to their care recipients. What we recognized is that there were so many similarities between caregiving for a child or adult versus an older adult, and we wanted to start thinking about what those similarities were and how, as a group, we might be able to move the ball forward on policies that might better help caregivers in general. So again, looking at this, we're going to go ahead and we're going to get our caregiver champions. I'm not going to speak anymore. I would like Heather Altman to go first, and then Brittany. If you could both introduce yourselves, tell a little bit about your caregiving experience, and maybe just mention why you think that that North Carolina looking at caregiving across the lifespan is an important issue to consider at this time. Heather, you go ahead whenever you're ready.
All right. Thank you. Hi, everyone. I see lots of faces I know. And as a number of colleagues and friends I'm looking in the Zoom boxes. And as many of you know, I worked in aging services for 20 years, more than 20 years. And then I quit a few years ago to take care of my parents, navigating the intensity of the ICU and the hospital for many months with my father. And then as he got better, navigating the intensity of the caregiving and end of life experience for my mom at home during the pandemic really showed me how much support family caregivers need. And so now I've been trying to find different ways to use my voice and my experiences, both professionally and personally, to elevate this issue. And I'm super excited to be a part of the Caregiver Champions. I'm excited to be Deputy Director of the North Carolina Serious Illness Coalition. The Executive Director, Virginia Slocum, is on, and the Serious Illness Coalition, which was mentioned before, so happy to be I guess 1/3 of the trifecta of fabulousness with the Coalition on Aging, North Carolina Coalition on Aging, and the Children's Complex Care Coalition of North Carolina. And so I'm excited to be a part of this and use my story and those of others to help elevate the discussion. Thanks.
Thanks, Heather. Brittany, you're on.
Thank you. Hi, everybody. I'm Brittany Cutshaw. I work as a parent educator for an organization called ECAC, the Exceptional Children's Assistance Center. But I'm here today to speak on this panel as a parent / caregiver of a young one named Nicholas, who is my son. Nicholas was born prematurely at 25 weeks and 1 day, which led to a long journey for him, trying to recover and hitting a lot of roadblocks along the way. And the journey's been really challenging for him, but also for every member of our family. And part of what I really honor about this group and has stood out to me and want to speak about today is how these conversations oftentimes do get really siloed. But through working with changing the caregiver conversation, I saw so many similarities with the way that being a caregiver has impacted me and the way that it's impacted everybody else across the lifespan.
Thank you, Brittany. You just reminded me at some point, we're running low on time, but at some point I would like to bring up the themes that we all came up with the first time we all met, which really resonates with everything we're talking about here. But I would now like to ask Aaron and Neil and David. They are our panelists who we're going to ask at this point, if you can just comment a little bit about what something we talked about throughout the summit. We're going to be asking people to think about gaps, policies that are either existing or that you might hope for that might better help caregivers across the lifespan. And also then how the caregiver champions and anyone who's involved in caregiving can consider using their voice to be an advocate to better support this issue. I'd specifically like you to talk about the caregiving across the life course and why you think that's important right now in this state. Aaron, if you wouldn't mind, if we can go Aaron, Neil, and then David, I think that might speed things up. Thanks.
Sure. Thank you so much, Karen. And I'll be brief, but just to introduce myself, I'm Erin Kent. I'm an associate professor in health policy management at the Gilling School of Global Public Health at UNC Chapel Hill. And I'm really honored to be here with all of you and with many of my colleagues who work on the North Carolina Serious Illness Coalition. So I want to just follow up a little bit on Greg Lank's comments about some of the policies that were put into place and how they sort of intersect with thinking about caregiving across the life course in North Carolina. Policy seems like such a big word, and it can be actually a little intimidating because we think about policy often on the federal level or maybe on the state level. But remember that policies can be local, they can be institutional, and however we move forward with supporting caregivers and really recognizing caregivers across our state, we're going to have to be thinking at these multiple levels and across sectors. So public-private partnerships are going to be really key here. We wrote this article to really try to bring together these three coalitions and really think about caregiving from the perspective of caregivers. So often caregivers are, if they're recognized at all, they're sort of an add-on, and we really are trying to foreground the experience of caregiving. So we listed 10 recommendations in the article. The first of which was really to try to promote the establishment of some sort of a task force to really examine existing policies, systems, and supports for caregivers, and then come up with recommendations to further strengthen what's out there for caregivers within our state. 11 other states currently have had or recently have had task forces to do just that, right? And a task force is supposed to be time limited, but the idea being that we have these coalitions in the grassroots level, but we really need something that's supported by, established by, connected directly with the legislature. I wanted to point out in the group of the trio of myself, David, and Neil, I wanted to just point out a couple of policies that are relevant for us to think about as a group, and then I'll kick it off to David and Neil. But in addition to the White House executive order that was passed that Greg mentioned that has specific details about needing to expand supports for family caregivers, my colleague Sue Deaton, who's a co-author, pointed out to me just yesterday that our own governor passed an executive order on the 2nd, Executive Order 280. Perhaps we can link to that in the chat. That is trying to establish North Carolina as a healthy aging state. And as part of that, there's a subsection, I believe it's a subsection that talks about supporting family caregivers. Now, it's really more about the care workforce, but there is potentially an opportunity, I see, maybe others see as well, to infuse maybe a subcommittee, some sort of a group to really tackle the family caregiver experience, thinking about it as integral to the care workforce. So I'll let somebody, or I can when I go on mute, link to that because that's just hot off the presses. And that's an example of how we can actually take all of our passion, our energy, and our experience and really start making our voices heard so that people start paying attention to a group of us that are often, unfortunately, invisible or voiceless. So I'm going to go ahead and pass it off to, was it David next or Neil? I'm sorry.
Neil's next. That's okay.
Neil,
Thanks,
okay.
Erin. And I went ahead and
Thanks.
put the link in the chat.
Thank you.
Thanks, Erin, and thanks, Karen, as well. So I'll introduce myself briefly. I'm Neil DeYoung. I'm a pediatrician at University of North Carolina in Chapel Hill at the Children's Hospital here. And I direct a program called the Children's Complex Care Program, where we provide full spectrum clinical care and care coordination services for about now 400 children with complex needs and their families from around the state. But probably more important to this conversation about caregiving, I would say that I've been a witness to the caregiving journeys and challenges of the families I've cared for over time. And I think Brittany probably said it far better than I ever could have. Versions of that story are what motivate me to be part of this conversation and to be part of this coalition. And David Ming, my colleague, may say more in a second, but we got involved in this work through what's called the Children's Complex Care Coalition of North Carolina. So we got together in 2020, about 1 year before this group got together, to think really broadly about the system of care and services here in North Carolina for children with complex needs and their families. And caregiving kept coming up time and time again as one of the key aspects that families struggle with. Many of the parents we work with are themselves full-time medical caregivers. Their children require daytime medical interventions, may require care overnight. They're not able to access direct care, and they're providing skilled work that's unrecognized. They're not paid for that. They're not earning benefits. They don't earn Social Security credits. Even the families that do have direct care workers in the home are often struggling when someone calls out sick or when they have gaps in the system of support that's been set up. And all of those unplanned absences from work, lead people to leave work or be unable to work. So we're talking about caregivers now who are providing full-time care at home with no support and no financial benefits. So I think all of the themes that have been brought up so far are things that just resonate so powerfully with me in my day-to-day interactions with families. I think of the three of us talking a little bit about the advocacy piece. And again, I would highlight in terms of advocacy, the voices of those who have lived experience. So I would point to Brittany and others who have videos recorded on the website as really great examples of self-advocacy. But in the things that I've seen and heard from families, a few others that I'll point out, one of the key areas of advocacy, I think, with regard to thinking about caregiving as a lifespan issue, specifically with regard to children, is linking access and eligibility for programs and benefits for caregivers with those of children. I think we do a fairly good job of investing time, energy, and personnel into publicizing benefits that are available for children, into trying to simplify the eligibility process where possible. There are a lot of ways that we as a state could do better with that. But there's a huge gap in the system of linking those pathways to access and information and support for children with similar pathways to access information and support for their family caregivers. It's a whole separate sort of processes and repositories of information that people have to go into or find out about, or often not find out about, to get support for themselves as family caregivers. So that notion of linking information about access and eligibility to benefits and programs is one of the ones that I think is a big issue of advocacy for lifespan. Some other things that I'll highlight before I pass off to David. The North Carolina Medicaid public comment process is a really good one to take advantage of. Oftentimes we find that people with lived experience are not aware of that process, are not logging in and providing public comments. But when they do, those are some of the most powerful public comments. So if it's possible to link somewhere the Medicaid public comment page as new policies come available, that's one that I would encourage people to check out. The Medicaid Ombudsman Program is one that some of my families have found very beneficial in thinking about trying to get access to supports and services for which they may be eligible. I'll highlight again the ECAC, Exceptional Children's Assistance Center, and some other family advocacy organizations like the Family Support Network of North Carolina that provide some talking points, provide peer support, provide guidance for family caregivers of children with complex needs, and are great places to get started. And finally, I would just highlight, just as others in this group are doing, that telling your story is probably one of the most powerful ways to advocate, not just for yourself and your caregiving recipients or your children, but also for other family caregivers in North Carolina. So through programs like this or through other avenues, I would strongly encourage everyone, to the extent that you're comfortable, to share and to tell your story. So I'll pause there and pass it on to David Ming for the last part of this triumvirate.
Thanks, everyone. It's truly an honor to be here. So thank you, Karen, Heather, for organizing such an amazing summit. And thanks for everyone for giving me a few minutes to join the conversation today. My name is David Ming. I'm an internist and pediatrician. I'm a hospital-based physician here at Duke. Similar to Neil, I've spent a fair amount of my work as a founding director of our complex care service at Duke Children's, which also provides wraparound longitudinal care coordination for children with medical complexity who are often needing to be hospitalized and have high levels of intensive long-term medical needs. I also have had the privilege of working with Neil and Aaron and many others on this call on our work on this topic of caregiving across the lifespan. You know, I don't think I need to repeat all the amazing comments that have been made, because I think they're just absolutely spot on. You know, when I'm thinking about my lens, I've really been trying to think hard about my positionality as a physician who a lot of my research work and my work in the clinical space is focused on the care of children and youth with special healthcare needs and medical complexity and the families who are caring for them. And I think what I may say, just to add on to this comment, is a really high level comment, is that when we think about all of the great work that's been discussed today, from the federal level that Greg Link just shared, to the state level initiatives and opportunities that Neil just highlighted and Aaron highlighted as well, is for us collectively to really lean into the idea that let's not forget about kids, you know, and let's really lean into that concept that the needs of children and families like Brittany's who are caring for children with special needs really are, I think, more similar than different than the needs of our caregivers who are caring for elderly and older adults. And I think that what I would maybe encourage and really highlight as a very high level, but I think critically important gap is to not further segment and silo our efforts when I think we're all on the same team here. And so that, you know, I am biased because I take care of hospitalized adults, I take care of hospitalized children, and I've always really felt like we really are stronger together, like Karen said. So, you know, I think that there may be frameworks for us to consider that can help us operationalize that in real world practice. So what might it take for our system of care, which, by the way, 86% of children and youth with special healthcare needs in this country lack access to a well-functioning system of services. So how might we have a system of care that really adopts a whole patient, whole child, whole family approach to our programming, to our interventions? Or how might we also develop these cross-sector, truly integrated care, which is across time and location? And then I think it's really important to, especially in a state like ours that's so diverse racially, ethnically, and also importantly diverse from a geographic perspective, that we not develop these sort of interventions and programs and supports that'll meet the needs of family caregivers and children and old adults living in, for example, Charlotte and the Triangle area. But this has to work across a wide spectrum of our state, with across the spectrum of rurality. So initiatives such as securing consistent, reliable, high quality broadband internet access is critically important issue across the lifespan. It affects children, adults, and everyone in between. So I'll just pause there. I just really appreciate this conversation. Just so honored to be here to learn and listen together.
Thank you all. I knew you would help us frame this entire summit, and you can all see why we have such interesting conversations when we get together every month. And by the way, our Caregiving Collaborative is the group that the people that you see on this on this panel right now, that's the group that we talked about earlier. It's a loose affiliation. Again, we would invite everyone on this call to participate. At the end of the slideshow, I actually have a link to the Zoom. It's a standing meeting that we have. And yeah, that's where a lot of these great ideas have come from. That's where the Changing the Care Conversation grant project came out of, and we're thrilled to be able to work with all of you. I'm going to give the last word to Heather or Brittany or both, if you want to say anything to wrap this up as the caregiver champions.
I would just say thank you. That was, I love, and I think it's coming through in the chat that we're all on the same team. And in our very first, I think it was our very first meeting, as we all introduced ourselves of the caregiving champions, it's powerful. It's very powerful for folks like me who are in the aging space and older adults to hear what I consider just the heartbreaking stories of those who started the journey with young children. And we identified those similarities, and that we all are struggling to make sense of the resources. We all feel alone. We also feel, I loved all the adjectives that Greg did, both a sense of joy and love and gratitude, but also a sense of just sort of despair and hopelessness, and not sure where to turn. And so I love that you highlighted that in your professional role that we have worked on. So thank you.
I agree with you, Heather. I think that's very well put. And I just wanted to reiterate that it's been such an honor to be a part of this group. I have never felt so understood in my journey as a caregiver as I have been through this project. So I think that this is really the right place to be at the right time.
Wow, thank you. What a great way to end this session. Heather, I'm going to turn it over to you while I share the screen again. Thank you all on the panel, and we'll move on to our next topic. I did want to mention, as I put this slide up, that you'll see when you all look at the when you get to the link on the Caregiving Across the Life Course article, these are the recommendations from that that's at in a table in the article that Erin mentioned. So with that, I will pass it to Heather.
Thanks, Karen. I appreciate that. That was just great, and a great setup for our next topic. And I think, I think what you'll hear is these common themes over and over from all these presentations, but Greg acknowledged it, and we saw it in the video, and we also heard about just the importance of adequacy of supportive services, formal services to support caregivers, to support the people that their loved ones are. And we talked about all of the diversity in North Carolina, whether it was racial, ethnic, geographic, LGBTQ communities, and all of these sort of systemic barriers that folks face. And so, as you can imagine, when we got our caregivers together and we talked about that, that was at utmost critical issue, but everybody faced the barriers in different ways. And it maybe was usually we think about there's not enough funding, or there's a waiting list, or we don't have income and assets, but really there were a lot of deeper conversations about simple things that could be improved in the system. And so we're excited to kind of embark on this particular issue around the need for services and supports in our focus conversation. So I will invite, and hopefully I can invite and spotlight people at the same time. Alicia Jones, who is you heard from in the video, is here today, as well as Joseph Wheeler, who you saw. Joseph, and welcome. Let me find. Oh, I don't know.
Heather, I was going to say, do you want me
to try? I can't spotlight Joseph. I don't know what I did.
Let me see if I can.
Bender, there we go. Can you start to do Joseph? I'm sorry. I'm seeing if I.
Yeah, let me see if I can do it.
Okay, I'm sorry. If you can take over spotlighting people, I would appreciate it. But anyway, and then we've got Denise Pasquarelli, who is also going to be joining us. So if you can't do that, that would be great. So anyway, we are glad to have you guys here. And Karen, we'll get you pinned up, but we're going to first start with Alicia Jones. And just as we did before, we would love for you guys to take a few minutes to introduce yourself, talk about some of the issues around access and barriers to service. And then what we'll go ahead and do is then I'll introduce our discussion panel. So welcome, Alicia.
Thank you. Thank you, everyone. I'm Alicia Jones. I am a mother and a grandmother of children with different abilities, as I like to say. And I'll start briefly with my daughter. She was misdiagnosed for years because no one wanted to take the time to listen to me about my child. I wasn't taking up for her. It's just that I knew her. And fast forward through, they gave her the usual ADHD diagnosis, which in the end, it turned out not to be that. She had a wonderful therapist that worked with her after their regular session one day for almost 2 hours on 5 math problems. And she determined that she was dyslexic. We found that out. We got the little service that were available to us. And sadly to say, not much has changed for dyslexia now. And my daughter finished high school, the AB honor roll, and typing 98 words a minute. And now fast forward to her daughter. I am raising 2 of her children, and her oldest has dyslexia. And as I stated, same diagnosis. They wanted to give her ADHD, and that's not what it was. And it's really sad. It's not that parents are trying to be argumentative and combative or anything like that. We know our children. And my daughter said once, "Mama, I know this stuff, but it's like when it gets ready to come from my brain to my mouth, it gets lost. I don't know what I'm doing." So we need more resources for everything, and especially not just that part of it, but the caregiving part of it. Because I did not adopt my grandchildren, we don't basically have any resources, period. Everything is on my family and I. That's just the bottom line. I chose not to adopt them because I didn't want my daughter to think that I was saying that you will never get your children back because you will never get yourself together. So I didn't want to do that to her. That's why I chose not to adopt, but it should not matter. These children are being raised. If you're not being raised with your parents, you should be given the same resources as foster parents. And the other thing that I would ask in here is please consider a whole health plan. You have to look at a person physically and mentally, because now we're dealing with the part of my grandchildren not being with their mother, not understanding why they're not with their mother, not understanding in their mind from listening to outsiders why my mother does not want me. And that's not the case at all. It's sometimes when people are in a bad situation or they're not secure mentally, if they can't love themselves, they can't love anyone else. So that's just what I would ask. Just think about more resources and consider looking at each person from a whole health standpoint and listen to the families.
Thank you, Alicia, so much. Renata, I'm going to give you the microphone.
Thank you so much, Heather. And good afternoon, everyone. So happy to be here. So I am Renata Bender, and I am a sibling caregiver for my sister who has cerebral palsy. I became her caregiver about 10 years ago after our mother passed away. And so we don't receive support from our family. And so I kind of figured that would be the case when I provided long distance care for my mother, who experienced a cancer, long-term illness, and we didn't really receive that much support. Long story short, I became my sister's caregiver at the age of 31 years of age. And so with that stated, I didn't get to experience a lot of things that, and the 31-year-old would normally experience. And so while I willfully accepted the task of providing care for her, I was also unprepared, as you all have heard before. I was unprepared to really advocate and navigate a system in North Carolina, which is often overwhelmed. And so there's limited supply, yet a high demand. And so I'm still learning how to advocate for her needs and address her needs, even now And so this includes, my learning experience with advocacy. As far as barriers, I would say increased, of course, direct supports, quality care would help me a lot. I can't adequately cover her expenses as well as my own, but I do what I can with what I have. And so that in turn often results in me neglecting myself and not a lot of the needs that I have. And I definitely want to avoid that, given that I am her only source of support at this moment. And so again, a barrier, again, direct supports quality care, the innovations waiver, which many individuals are on that list for 10, 15, 20 years. My sister has been on the list for about 10 years now. And so, I think those things should be addressed. And I believe that's it. Also, I want to say that just again, thank you so much for having me or including me as part of this conversation, because it allows me to feel heard. In the past, as a caregiver, when I have expressed my concerns, whether it's through a professional agency, family, associates, often it's ignored or it's critiqued from individuals that may have never walked in those shoes. And so that's very frustrating. And so again, just thank you for allowing me the opportunity to not only advocate on behalf of my sister, but other families who have similar struggles as my fellow caregivers here on this panel. Thank you again.
Oh, absolutely, Renata. And when I look at all four of you, one of the things that I think of is that, and we often say family caregivers, but I want to make the point that we're really talking about really inclusive, wide families, and that families can mean a lot of different things. So, and I think this panel and your group really demonstrate that families mean a lot of different things. And so we're glad to have you here. Denise, we're glad that you're joining us today. I'll let you introduce yourself.
Okay, thank you, Heather. I'm Denise Pasquarelli, and I'm so grateful to have this opportunity. My son is 23 years old and has intellectual disability and epilepsy. And he is one of the 16,000 people on the wait list for the innovations waiver. We are coming up on 10 years. This waiver is a source of funding that would enable people with intellectual and developmental disabilities to have what is needed to live a full and meaningful life in their community. In 2021, my son graduated high school, and together our family fell off what's called the service cliff. People like us are experiencing a caregiving crisis. Without the waiver and the direct support staffing needed, the door to these services is closed to us. As a result, our son's needs are unmet, which deeply impacts our lives. Very simply, we are living his life with him and for him. Without the waiver, my son is denied access to housing to live on his own with support. He's denied the job coach he needs to go to work, and he cannot have the assistance he needs at home and in the community. And in addition, I cannot receive any compensation for my caregiving. There's also a direct support worker crisis. Competitive wages and training is desperately needed. So this crisis means that although we qualify for support, there is either no staff available or those sent to work with my son aren't qualified. For instance, lacking good judgment, having the inability or lack of interest in engaging him appropriately. So we are left to find quality support on our own. In speaking with a fellow mom and caregiver, she remarked, "Why does my dog get this care when I board him for $50 a day, but her son cannot? My dog sitter is thinking about socialization, challenges with eating, mental stimulation, and creating a warm and caring home away from home." So currently, my son receives support, and I receive respite from my 80-year-old mother, and at times a revolving door of students coming in from a local college. And as a result of all this, I am my son's full-time caregiver, facilitating his schedule every day. I get him ready every day, create and facilitate a productive schedule, his meals, his transportation, his healthcare, and more. I'm his reader, his writer, his reminder to do 1,000 things throughout the day. I do this with all my heart and all my love for him. And also, I have a sense of
I've lost myself. I've surrendered the career and education that brought me personal satisfaction, the joy of interacting with colleagues, and the opportunity to have a paycheck. I so appreciate the chance to talk with you all, and I appreciate any insights you all may have in response to the crisis we face. Thank you.
Thank you, Denise, and thank you for sharing, and thank all of you. It's a courageous thing that you've done, and to be able to share so much of yourself and such a personal side. So I appreciate it. And Joseph, I'll turn it over to you as our only male caregiver in the group, but we are glad that you're here. So tell us a little bit about your experience.
Thank you, Heather. And thank you, everybody, for being here. Really appreciate the opportunity to share in this conversation. And Heather and Karen and the others who put this together, thank you so much. When I met my husband, I was in my mid-30s. He was in his late 50s. And then he was in his 60s, and then his 70s, and then his 80s, and then his 90s. And there was a change in each decade. And, we've talked about this caregiving as a journey. And I think of it as a bumpy road, a rough ride, through unexplored territory, and things. My caregiving work started actually back in 2013 when my best friend was in an automobile accident and had traumatic brain injury. And I shared in his caregiving with his children. But in 2017, my husband broke his hip. And I tell people that was the last day he drove a car. It was also the last day that he washed any dishes. There were a number of things that I took over and became responsible for. The good news for me is that I have operated as a consultant for the last 30 years. And because of COVID, all of my work went virtual, or I could not have continued my work because it didn't work for me in his situations over time to be away from home. There were a number of hospitalizations for various kinds of things. I made a point of getting him to go to the YMCA to ride the recumbent bike 3 times a week until he was diagnosed with cancer last year in August, and December 22nd, he died at home under the care of Transitions Life Care Hospice. What I would say is that I feel quite fortunate that we have been able to organize our lives so that I could provide the care that was needed. But what I also realize is that many folks in the healthcare system, in the senior services systems, et cetera, are just getting to be aware of same-sex married couples. And we have not always had the best experience at a societal level around discrimination, around people being confused about comments that were made. And so the work I do as a volunteer is with seniors who are LGBTQ+, and a lot of that has to do with educating senior service workers. With that, I'll stop. Thank you.
Thank you, Joseph. I appreciate those comments about the really critical nature of being culturally competent, especially when you're providing care in somebody's home, which is such a personal space. So we're going to add some voices to our conversation and to react, but also to make to comment on their expertise from the kind of their professional association. And I'm just going to say I'm having a hard time with pinning Sabrina right now, but I will introduce Sabrina. I think if you take maybe yourself off of, if we see your camera, then I think I can spotlight you. But Sabrina Lee, we are really thrilled to have her. She's with North Carolina Division of Health Benefits. She's the Deputy Director of North Carolina Long-Term Services and Supports within Medicaid. We also have Jennifer Mahan, who is the Director of Public Policy at the Autism Society of North Carolina, and Scott Hedrick, who is the Director of Public Policy with the Alzheimer's Association North Carolina chapter. So welcome all of you and to this conversation. And similar to the other segments of these, we really want to focus on your thoughts around some of the gaps around barriers to some of the topics that you have heard from the speakers. Also, what are some of the existing or potential policies that we could see improvements? And where, the third thing, and I'm just going to front end you with all the questions, are some of the roles that you can see the potential for strong advocacy for caregivers to make improvements. So I'm going to start with you, Sabrina, to kind of react and put your thoughts out there for us.
Well, thank you, Heather. And I am having connection problems. If I get another signal that says my connection is unstable, I'm going to turn my camera off.
That's perfectly fine. We all understand you. We get it.
So having said that, I want to express my personal appreciation to all of our caregiver champions for courageously and articulately and passionately sharing your story. Please continue to do that because we need to hear, and it is your stories that fuel the passion of me and probably close to 500 other people who wake up every day and come to work at the North Carolina Division of Health Benefits, led by our Deputy Secretary, Jay Ludlam. So thank you for that. Well, my reflection is I'm Sabrina Lee, and what I do is I am the Deputy Director for the Division of Health Benefits, and that is a LTSS portfolio across the lifespan. So our youngest member was born today, and our oldest member, some of you have heard me say this before, is either living at home, like my 90-year-old mom who just stuck her head in the door, who suffers from dementia and some other chronic illnesses, or an elder adult who is in a nursing home or an assisted living, living out the rest of their days. I wake up every morning with that awareness and the things that have been articulated about integrated care, whole person care, person-centered care, the integration of family, all resonate with me and all help me frame in some very important ways the criticality of the work we are doing right now as we transition our Medicaid system from fee-for-service to managed care. Medicaid is hard. Healthcare policy is even more complicated. Often people learn about the services that are covered in Medicaid and the services and the supports available by word of mouth, by people who have lived experiences, both favorable and adverse. And it challenges me every day. And as I look at the panel in front of me of people, I have worked with many of you across the varying iterations of my career, and we've all been fueled by the passion that it ought not be that hard for people to get answers to very basic questions about eligibility for services. So gaps. Well, for me, information exchange, the information exchange between Medicaid and our beneficiaries, the information exchange between Medicaid and providers, both mom and pop providers and providers who are supported by large corporations, the information exchange between providers and their care recipients. So for me, one of the huge gaps is communication driven by silos related to services. we learned how to bust some of those silos real quick and in a hurry during COVID. And I'm happy to say that we are moving forward with maintaining some of those connections and some of the nuanced policy flexibilities. We are finding ways to implement them in ways that we didn't pre-COVID believe that we could, but learned that we could, should, and must continue. Policy gaps. Historically, we had limited flexibility in how we administer healthcare services. However, I'm proud to reflect on the fact that over the last 10 years, partly through advocacy of people like yourself saying, we've got to do this better, we have matured in our ability to utilize the Medicaid, the federal authority of waivers to deliver services. The best examples I know are the 1915C waivers, our CAP-DA waiver, our CAP-C waiver. And while neither of those are the perfection of what kinds of wraparound services are available, we continue to mature in our ability to add flexibilities and services and to use data in ways that we haven't before. Another wonderful example is the work we're doing around social determinants of health, using the 1115 waiver authority. So our policy skills and opportunities and the things that I'm hearing coming down from the feds about opportunities to direct payment for direct care workers and others and to leverage how much of the increases must go to fund the salaries of people providing services. I think that advocacy, and I know I've used up most of my time. I think my guidance about advocacy or my advice about how we can work together, because I've already heard it echoed, the reminder that we are all on the same team. I think the best way advocates and policymakers can work together is to invite your inquisitiveness. So I always say to advocates, and I learned this from Mary Bethel many years ago, it's be inquisitive versus adversarial. Assume best intentions, understanding again that we are on the same team and that as policymakers, we want to figure out how to get the services and supports that are needed to care for individuals in the least restrictive settings possible. I think that I would also suggest that accuracy is really important in terms of how you are sharing your story. I always get a little nervous about the benefits that we see out of social media, but I also get a little nervous because I have seen social media used to frighten people in ways that for people whose lives are already extraordinarily complicated, they don't need to be frightened. And so I think that's a cautionary word for me in terms of advocacy. But lastly, I just want to express my appreciation to Heather and to Karen and to others who are leading this effort for the opportunity to participate. I will always answer when you call and ask for an opportunity for us to dialogue together. Thank you.
I appreciate that. And I know we're getting close to time, but we want to have a complete conversation here. So if folks need to go, we understand. Hopefully Jennifer and Scott can hang on because we're recording this and I think it's just, we can reflect on it. So I apologize, we're running a little bit late, but the value of this is the conversation. And so, Jennifer, I'll turn it over to you because you've got, kind of in contrast to Sabrina, who's been a public servant and kind of involved in these in a real implementation phase around a lot of the services and supports. You've been on more of the patient family advocacy side. And so reflect on kind of what your thinking is on what you've heard and where caregivers specifically are engaged in this work and how would you encourage to continue that?
Absolutely. Thanks. I want to thank everybody for being here and hanging in there. I don't think I have to talk about the gaps and the things that you all want and need, because you've articulated that really well today. And you all are living that experience of not having the services and supports that you need within your family, within your lives. So I'm just going to encourage you all to make contacting and talking with, communicating, making yourself visible to your public officials, elected officials, policymakers in our state government, to make that connection with them and that communication with them a habit. Advocacy, many of us have been advocating for, in some cases, decades, for some of the changes that we want to see happen for people. And we see change happen very slowly. I really, truly believe that if you want these policies to change, there are solutions to them, and our policymakers are capable of implementing those solutions. They are capable of paying people more. We have the resources in the state to do that. They are capable of expanding eligibility for programs for healthcare. They are capable of creating and partnering with communities across the state to create a more diverse workforce, to ensure that there are services, not just in urban areas, but across rural areas as well. We can absolutely do this, but the advocacy needs to happen on a regular basis and needs to go on, even if you feel that you're not being effective right now. You can be effective over time.
Thank you so much, Jennifer. And I appreciate your years of experience in this space and from different perspectives. And so next we'll welcome you, Scott. And as I said, Scott is the Director of Public Policy at the Alzheimer's Association.
Yeah, thank you, Heather, and for having me, and Karen, as well. I appreciate this conversation, and a lot of the caregiver stories are moving. I'm going through the journey again with my brother who has frontotemporal dementia. So I understand exactly what you guys are going through, and it's hard to vocalize it sometimes and to talk about your story because you're so close to it, but you all have done it very eloquently. But to jump in a little bit, I work for the Alzheimer's Association, and we represent Alzheimer's and other related diseases that cause dementia. So it's somewhat more nuanced to the caregiving experience. People tend to think all of our work is done with people who are in the what we would consider the geriatric years, but that's actually not true, because Alzheimer's disease in many cases starts 10 to 15 years before you see a symptom. So middle ages, and their children are often still in school, high school, and sometimes middle school, things like that. So when we look at a lifespan connection with dementia, we don't typically view it that way. We view it as something that happens to older people, to our parents when they're in their 70s and 80s, but less and less is that proving to be true. So I was coming to talk specifically, about some of the policies that that we utilize for caregivers, as well as to talk about the gaps that are big for Alzheimer's disease, because Alzheimer's, people live with it 10 to 15 years, is the cost. It is incredibly expensive to care for somebody with this disease. It can be, if 80% of people that are caring for a loved one with Alzheimer's disease do it in their house because they cannot afford long-term care. So that's a huge gap. There's this donut hole that has existed since I've been there 12 years, where people cannot qualify for services because they may make too much money due to a pension, something like that. They still don't make a lot of money, but they cannot afford the cost of care for their loved ones. So access is a big issue with regard to policy. So access to home and community-based services, access to things like personal care services, anything that will help that home caregiver, are strategies that we pursue from a legislative and policy related level. On the federal level right now, we are very much looking at access to treatments and making sure that's an equitable access to FDA approved treatments. You might probably seen some some of that in the news media lately. There are 3 drugs that now actually target the proteins that cause Alzheimer's, that we can actually reduce those plaques. And there's a lot of going back and forth on, are they viable treatments? The other thing is that I think is very important is public health. We are designing policies to look at the problems that we encounter through a public health lens, and making sure that people understand the burden is large and that the impact is huge. There are over 18 billion unpaid caregiver hours annually with regards to Alzheimer's and other types of dementia. So there are so many people that are doing this in their house, caring for someone in their house, and they need help. And so one of the things with Alzheimer's that had not been much of a conversation up until lately, and is that there weren't viewed a lot of ways to interview. And people did not think that there were a lot of ways that they could do anything to control risk or things like that. But we do know now that there are a lot of factors that can reduce risk of cognitive decline. And so how do we promote those? So in North Carolina, we had done some work with a grant, and Renee Myatt, I know, is on this call, and she was part of the BOLD she's our BOLD coordinator, which builds an infrastructure for dementia from a public health lens. So those are some programmatic things I think that are important, because people need to understand they need to reduce their risky health behaviors, manage their comorbidities. 95% of people with Alzheimer's have something else as well. They have a comorbid condition. And we need people to have access to diagnoses. It is one of those diseases where a diagnosis is still hard to obtain. And so 45% of the dementia that is out there in the country is generally undiagnosed. So we need to drive people in rural and minority communities. And that a lot of that is going to come through policy-related campaigns or state agency-related activity to push that information at the public health level, at the county level, out, so people have access to not only risk reduction measures, but access to treatments and clinicals and stuff that are done through a very culturally appropriate and equitable lens. So those are some things. And with regard to advocacy, we use advocates all the time. We couldn't do this work without them. We have state level advocates, we have national advocates. But to be an advocate means basically that you're just stepping up to voice something for somebody who can't voice it for themselves. That's basically what an advocate is. So whether you're in a programmatic role and you're going out and doing education, or you are talking to the legislature at the state level, or going up to Washington, or maybe doing a radio interview, something like that. But the biggest thing that I keep hearing on this panel that I think is important is share that story, your family connection, because we don't live in statistics, we live in narratives. We live in the story of our lives, and that's what resonates with people. So policy makers, people that have the ability to move the needle, they also are caregivers. They also are dealing with this themselves. And so they need us to humanize our issues, whether your issue is autism, whether it's cerebral palsy, whether it's the humanization of our issues allows them to better create policy, because they get it at that point. So that's what I would say.
Thank you, Scott. I appreciate that. And I just, that collective advocacy, across these different, we're all in the same team. I think it can really help moving the needle and creating some policy levers that can benefit all caregivers. But I also appreciate just the different comments about the different types of advocacy, right? They all look different. And by telling your story and being brave and letting folks know it doesn't all have to be at the North Carolina General Assembly or in the halls of Congress, that there are ways to get out the word and educate about your life and about the changes and the meaningful changes we need to see in North Carolina. So with that, I'm going to conclude this segment and bring Karen back so we can just go through kind of next steps for tomorrow and what to expect. So Karen, if you'd come back, that would be great. And I just am really grateful for the time that everybody's taken today, and just these meaningful conversations and centering the stories, but really it's not stories, it's your lives. And so being able to do that in a public format so that we can all benefit from it, but also seeing where we have common interests and themes. And Greg said it so well in his slide in terms of identifying many of those cross-cutting themes that we heard today.
Yeah,
Karen?
and I just wanted to, I'm just putting up contact information. Since we don't have a lot of time, we can go through some of this tomorrow when we recap day one. I think everybody did an amazing job, not only telling their stories, but then we appreciate the panelists. First of all, staying on a little longer. Thank you so much. But wrapping in what you do and tying it into those caregiver stories is exactly what we need right now. And we would encourage you all who are in that advocacy space or policy space, if you anything you are working on that you want to post in the chat or send to us that we can include to continue to encourage these caregiver advocates to use their voice, and the others on the call that are caregivers, to use their voices to help promote what you all are doing. So thank you. We put both the Changing the Care Conversation project page with all the videos. We encourage you to look at that. There's way more information on that about everybody's stories. And then we're just throwing this out there that if you are considering continuing this conversation beyond tomorrow, that we meet once a month virtually the first Friday of each month from 12 to 1 p.m. It's a quick meeting, and this is what we've been talking about for a year and a half. So we would look forward to at least putting that out there as maybe the next steps, to consider talking about what the next steps are going to be going forward on this. Anything else we need to talk about before we wrap it up for the day? I think we've done a lot.
No, and we look forward to seeing you tomorrow at 12 for the second day.
Thank you all very much for attending and for participating.
Okay,
thanks to
bye-bye.
I want to say thank you to our champions. Thank you to the panelists. Thank you to everybody who supported this work. Community Catalyst. I think Sienna Ruggieri was on the call. I don't know if she still is, but thank you. And thank you to Grantmakers and Aging for funding this project that this summit is a part of. See you tomorrow.
Thank you guys. Have a good afternoon.
Bye-bye. Thank you.